All right. Hi, everyone. I'm Sarah Kipperman. I'm an assistant professor at Wayne State. I'm presenting with London today. I'm going to be doing the research portion, and then London's going to share some of her story. So this right here, if everybody gets a piece or gets this presentation, this is just a really nice PDF that talks about access and equity with a lot of resources. As I'm talking about access and equity today, I feel like there's so much to cover that I'd like to just focus on the idea of medical mistrust, the idea of how when we lack knowledge as providers, I'm a psychologist, so when we lack knowledge of how to be culturally responsive and training in working with LGBTQ plus individuals, we then are creating barriers that prevent people from wanting to seek out care. And so we're going to talk about some of those numbers and then head into our breakout. So please be mindful that I'm only presenting one piece of the puzzle and there's so much more to explore in your discussion. All right. Okay, so these are just some numbers to reflect on that 47% of transgender individuals say they experience some form of negative or discriminatory treatment from a doctor or healthcare provider. 20% of LGBTQ plus individuals have avoided a doctor's office to avoid experiencing discrimination. And of hospitals that have non-discriminatory policies, 67% have a non-discrimination policy that explicitly includes people with diverse sexual orientations and gender identities. Of the transgender population who was surveyed here, 73% reported that they would be refused medical services because of their LGBTQ status. Additionally, 16% of LGBTQ Americans have postponed or not tried to get preventive screenings because of experienced disrespect and discrimination from doctors and other healthcare providers. And lastly, 29% of LGBTQ Americans have reported experiencing discrimination in the past year because of this, have postponed or not tried getting preventative screenings because of that disrespect. All right, so next slide. Okay, so this is a survey that was completed that asked about experiences with health providers over the last 2 years, and this is comparing LGBTQ plus individuals' responses with non-community members. When asked, have you experienced healthcare providers not believing you were telling the truth? 16% compared to 8% of LGBTQ community providers endorsed this, so that's more than double percent. 21% of LGBTQ community members shared that healthcare providers assumed something about them without asking, compared to 11% of non-LGBTQ community members. And lastly, 29% of LGBTQ community members reported healthcare providers dismissed their concerns, compared to 16%. So about double in each of these. It's about double the rate that LGBTQ community members are experiencing challenges with medical providers. Next slide. Okay, so this is just more statistics. 56% of lesbian, gay, and bisexual respondents had at least one experience of discrimination and experiencing barriers to access to care when going to see a physician. And of the transgender and gender nonconforming respondents to this survey, 70% experienced discrimination and barriers to their medical care. And 63% of respondents living with HIV experienced discrimination in healthcare. Next slide. So this is by the Trevor Project. It looks at rationales of LGBTQ youth. What is your barrier to accessing mental health services? It shows the most common reason for not accessing services is not being able to afford it. Additional rationale was not feeling comfortable or able to get my parent or caregiver's permission. Not being out as an LGBTQ plus individual and being afraid that seeking services would out them. Previously having a negative experience in care and wanting to avoid having another one. 20% reported not feeling that the provider will understand my sexual orientation or gender identity. Other responses include not having a way to get to the location, having a parent or caregiver not allowing them to go, thinking that the provider will only focus on sexual orientation or gender identity when that's not necessarily the primary reason they're seeking care, not having providers that people know are part of the LGBTQ community, and not having services within reasonable distances. Next slide. Okay, so then as far as perceptions of LGBTQ community members in research reporting on perceived discriminatory experiences from providers. So many lesbian, gay, and bisexual individuals have experienced verbal abuse or disrespectful behavior from providers, where 30%, while 37% of surveyed doctors had awareness of having lesbian patients in particular, but only 5% had asked about their client's sexual identity, and only 11% were aware of any health concerns specific to their lesbian clients. Additionally, lesbian, gay, and bisexual persons have refused treatment from providers because of discriminatory practices. Providers have also reported not having enough training to care for lesbian, gay, or bisexual person, and report lacking knowledge of culture-specific stressors, and report feeling uncomfortable providing care to for lesbian, gay, and bisexual patients because of lack of readiness to serve. Also, of people who were surveyed, those self-identified women sensed their physicians' discomfort and lack of attention and care from their providers. Next slide. All right, so even though we're talking predominantly about medical mistrust and the lack of competence that may be there to provide services, there are additional barriers that I just wanted to comment on. While there are culture-specific stressors that the LGBTQ plus community experience, there's completely different stressors, but related when approaching medical services with marginalized identities. Racial status, education and income level, geographic isolation, immigration status, language, cultural beliefs. These are all factors that influence how people are seeking out services, and where people may have experienced discrimination and barriers to accessing services in unique ways. And what's important to recognize is how these link and overlap with one's sexual orientation and gender identity. Also, cost and affordability. Where people may not have insurance or may have to disclose information because of the insurances they have, we recognize that this is a potential barrier as well. Next slide. So even though I'm talking about barriers and we're all probably like, is there any way around this? I want to point out on the last slide that it's not inevitable. There are barriers, but we can address them. What we do see is when people experience perceived homophobia or transphobia from providers and have discriminatory experiences, we see a decrease in people's willingness to access care, and we see a decreased willingness to discuss health. And we see a decreased willingness to disclose identities and individual truths to providers, which prevent people from seeking culturally relevant care. However, when providers present as knowledgeable, are LGBTQ friendly, are perceived as being accepting of LGBTQ community members, we see increased access to care, willingness to seek out care, increased willingness to have discussions about health, and increased willingness to disclose one's identity and truths to their provider. And that is my presentation. And now if London would like to take, and these are examples of providers in the area with their contact information who are regarded as providing affirming care and who have endorsed having significant experience working with LGBTQ community members, as well as having affirmative practices. All right, and now London, please take it away.
London, do we have you on the phone?
Can you hear me?
Yes, we can hear you. Okay. Oh my God. Thank you. I don't know what happened. I'm still joining breakout sessions according to Zoom, so I'm here. I kind of missed like your entire presentation trying to get here. So
That's
my
okay.
apologies.
Yeah.
So access and equity. Um, hmm. So my portion was very much so speaking on self. The barriers I have had accessing and being treated equal in these public settings, as well as like health offices and things of that nature. Um, so when we think of access and equity, we pretty much thinking of being able to access somewhere and being treated fairly as everyone else would be. How often does that take place? Being a trans woman of color, I have came across some times where it wasn't easy for me to get the access to these places that I needed and be treated fairly. So it was kind of either or. So then I started venturing off and finding my way and made myself an example for my community and started being able to access and finding places that would treat me equally. And so that's how I started navigating through the system and showing my community the same thing. It can get very discouraging. A lot of us do not seek the professional help we need because of the things that we go through, trying to access and be treated fairly. So we kind of fall to the wayside. So I always try to use positivity and myself, as like I said, as an example to navigate everyone through the system, if that kind of makes sense. Sorry, I'm kind of thrown off about all of this technology stuff kind of at this very moment. So kind of bear with me here because I kind of lost everything. Still sitting here waiting. So yeah, I'm sorry.
No, you're doing fine. Just you keep go ahead. We're with you.
Okay, so yeah, back to the equity aspect of it all. So, like for instance, speaking here, an example of having a doctor's appointment. I have a 9 o'clock doctor's appointment. I get there at 8:45. Someone misses their doctor's appointment and gets there at 9, but they had at 8:45. So now I've been pushed back because this person just walked in. So now they're in my spot. So now I'm missed out. But last week when I came, 5 minutes late, I had to reschedule. How you think that makes you feel? So it goes back to how is it that I'm not able to still be seen, but this cisgender male is, and he was more than 15 minutes late and I was only 5. So it kind of raised questions and eyebrows there. Then when you finally do get seen, it's very brief, it's very short because no one really actually wants to see you because of who you are. So again, it gets frustrating and we kind of fall to the cracks with it. So the references that Sarah has given you, I think those are like some really good places. I have encountered a lot of those places now that I'm looking at it. So yeah, basically we're moving in the right direction if we keep going in the right direction, if that makes sense.
London, I'm going to jump in and just ask as we get ready before we go into the breakout rooms. What do you look for? What are some signals for you in terms of going to a healthcare provider and thinking about inclusive care? Like, what are you looking for? What's meaningful to you?
So to be honest, first impression for me is everything. If you greet me with a smile or with positive energy, that can basically take us a whole long way instead of you looking up, not giving me eye contact, not greeting me, and have negative attitude. And that can go from the look, the body language, anything. So the first impression is the biggest thing for me. when I go to anywhere where I seek services.
And some providers have gone through different training. Some offices, they have maybe little stickers or little signs that say they provide inclusive care, affirming care. Are you looking for things like that? What does that mean for you, or mean anything to you?
So when it came down to that, for me, I didn't look for stickers, because just because you have a sticker doesn't mean you practice that. I look deeper into who you are as a provider. Like the provider I have now, I did my research on the provider, and my provider is excellent. And I have never had a provider like the one that I have now that's knowledgeable, that's willing and able to do what's needed for the community. And I refer her to everyone. So just because it's a sticker and a sign does not necessarily mean that they practice those practices. You have to do your research, especially if you're looking for something specific.
And London, this is Rick Zimmerman here. I just want to ask, when you say, the minute you're greeted, I'm guessing that includes the person at the desk, the receptionist, and not just the providers. Is that right?
Starts at that desk. The moment you walk into that office and you sign that list, put your name and let them know that you're here, it starts right there. The reception can leave the nastiest taste, and you will not ever want to step foot back into that office, whether they're gone or not. You would never want to endure that again.
Thank you. Sorry you experienced that, but thanks for sharing that.
Oh, my. I like the question part. You can ask me the questions and I answer for you. You can tell. Any more questions? Oh, okay. That's it for me.